And welcome back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. Thanks so much for sticking with us. And we're still celebrating the winners of the Health Value Awards. They were given out last night. We're so pleased to have Adam Russo here in the studio. Adam, thank you so much for being here.
It's great to be here.
Well, congratulations to you and the Phia Group for this award. And tell me the category that you won it in.
We won in the employer under 250 lives.
Okay. And what sort of criteria do you think really caught the attention of the panelists who were deciding this award?
So, well, my company, in the first place, what we do is cost containment options for self-funded employers. That's the business that we're in. So we look at our company as the testing ground or the guinea pig to try out new ideas. And I think that's where we differentiate from other employers and other self-funded employee benefit plans, is that we really try to innovate in our plan design. Meaning, I have yet to see another company have the type of benefit structure that we have, where our entire focus is to try to have our employees not be patients of healthcare, but become consumers of healthcare. And that is the key differential between our plan design, I believe, and what the rest of the country is doing today. And I think that's what the judges noticed when they made the right call.
Yeah, all right, the right call. I like that. So tell me, what is the difference between of a consumer of healthcare and, you know, what is your definition of that?
I mean, here's a reality. So my company, the Phia Group, we represent over 9 million employee lives nationwide. Everything from small school districts to the entire states, private companies, public companies, you know, every type of demographic, every type of employee you can think of. And they all share the same problem. Costs continue to rise. And no one really understands, especially here in Washington, nobody really understands what to do about it and how to make that change. So what we've done is we are trying to get, and we have successfully done so, is our employees are incentivized through money, through prizes, different criteria, to actually care about the whole cost of the entire bill. Most people with health insurance, they believe the bill is their copay or their deductible. They don't realize that when they go to a hospital to deliver a child, that the price range could be anywhere from $8,000 to deliver that same baby to $30,000, because in their minds they're paying $250. Mm-hmm. That's their out-of-pocket, or their family, deductible is $4,000. What we're doing is trying to get every employee and their dependents to realize that just like you make a choice when purchasing a television, mm-hmm. you can make that same kind of choice when purchasing and deciding what healthcare provider, what facility to go to have your care. So as an example, with the delivering of a baby, in our system, in our network, in our benefit plan design, if a mom, she can go to any hospital she wants, obviously, in the network. But if she chooses on her own fruition to go to one of these 5 hospitals where the cost is literally a third of what it would cost at another hospital, even though the quality rankings are the top in our state, what we'll do is we'll give them free diapers and wipes for a year, mm-hmm. for their child. Mm-hmm. So when people have those incentives, they change their behaviors. And as long as you get your employees and their members and their dependents to actually care about the overall cost of care, mm-hmm. you change the behaviors of people, and they actually look at healthcare as a consumer would and make the right choices, which will allow them to lower the overall cost of care, which has totally changed our premium in our office. And we now use our health benefit as a way to incentivize and entice people to want to work in our company. Right. So it's been great on both sides.
Sure, excellent. Do people pay attention to these kinds of awards?
Oh, no question. So, I was pretending to not care about winning, because you just want to psych yourself out. But I'm not going to lie. I actually brought my best friend here from Boston. We've been best friends for 40 years. I brought him here with me, to hopefully win and maybe celebrate a little bit. And so when my name got called as the winner, and our company was the winner, obviously not just me, but our company, but it's like my child, right?
Yes.
I built this thing from nothing. I started crying. And the first thing I did was I left the room, and that's why I probably, I didn't notice all the different things going on. I just picked up the phone and called my mom. Oh. And to me, it means a lot. I think to most people it does. I know that when I posted it on LinkedIn, I got more comments on this than most things that I post, even though the other things that I post actually have meaningful stuff in it regarding healthcare and how to change our behavior and change our industry. But I think people just like to get awards, and I think it does resonate when so many other really great, amazing organizations we're all not only submitted applications, but we're nominated to be recognized as the best of them is an accomplishment.
Really an honor.
I take to heart.
And I do think it's significant that you called your mom because you started the company in your mom's basement. Isn't that right?
Yes. Total investment of $4,000. And that was in 1999 with my best friend from college, Mike Bronco, who's my partner now. And worked as a waiter for 3 years at a restaurant below our office. And today, like I said, we are, in my opinion, we're the fastest growing company in our industry. We have 30% growth year over year. And it truly is because 18 years ago, we knew that something would have to change, that you couldn't just keep on having 10, 20% premium increases every single year and get away with it. So we started really putting true cost containment in, and by looking at your claims data and then analyzing it and realizing that not every employer is the same. What a Teamster or what a truckers union needs for benefits is very different than what a school teacher needs for benefits. So we design benefit plans, and then based on the type of plan, the need they have, of what type of actual coverage and benefits they need for their population, you can design a plan that not only is, not I want to say low cost, but a lower cost, but also a plan that basically makes people want to work there. Mm-hmm. It makes them want to get healthy. It makes them want to come to work every day. And that, I think, is something that I think today, getting this award proved that we're doing the right thing.
All right. Adam Russo, thank you so much for stopping by. And congratulations again.
Thank you so much. Appreciate it.
And thank you for sticking with us. We have one more interview coming up. Stay tuned.